I wanted to ask a question of Ray and Nish. Are there any clever new techniques and scans to look at endothelial dysfunction? That is the inner lining of the thing, because that's what we want to know about in children and adults and monitor them long term.
Yeah, so that was exactly what I was just about to say in response to what Tricia and Nish were saying. And one of the things I was going to say is, you're absolutely correct. Because it's there doesn't mean it's causal. But one of the things I found quite interesting, Trish, was I don't know if you've seen the NACME registry data coming out of the States from the North American Angioplasty Society. So in the UK and in the US, we have a database of every single STEMI, that's ST elevation myocardial infarction. Those are the really big, dangerous heart attacks that happen. Sorry, I'm not explaining that to you. I'm explaining it I know you know what that is, but for the purposes of
useful to have a reminder, though. Thank you.
So, and what we're seeing is that there's an excess of MINOCAs. Now, MINOCAs are when we rush these people to the cath labs and we put the catheter in the artery and we go down and we squirt dye down their arteries. Normally, what we see when they're having a STEMI is that there is epicardial coronary artery disease on the back of atherosclerosis, which is cholesterol plaque disease. There's a lesion there, and the plaques become unstable and it's ruptured and it's become inflamed and it's got a clot over it. And that is the normal pathophysiology of a heart attack. But on the NACME registry data, this is not what they were seeing in patients with COVID. They were seeing MI without obstructive coronary artery disease. And that to me is very telling. And I think now, again, it's not proving causation, but we do see this. We do see it in our clinical practice, but usually in about 5% of individuals will have a MINOCA when you take them to the cath lab. 30% of women after COVID are having MINOCAs. This is unheard of. And it would probably fit, and I'm saying probably because we haven't proved causation, but it would probably fit with what we think we're seeing with regards to endothelitis and microangiopathic thrombosis, I think. But this definitely needs studying more. And to come on to your question, Anthony, is yes, we can, and yes, we are about to. So Rhizia Pretorius, who's part of the international research collaboration that Graham and I are in, is already doing quite a lot of work looking at endothelial markers in individuals with long COVID. One of the research trials that I'm in, and I can't talk too much about yet because it's not quite ready to go, but we are looking at similar things, but we also have a machine that will allow us to test endothelial function in everybody.
That's really interesting, Ray. Graham, are we seeing differences in clots in the